Greetings, and welcome to Dougy Dialogues. I'm Dr. Monique Mitchell, and we're webcasting from Dougy Center in Portland, Oregon. Dougy Center, the first childhood bereavement center in the United States, is recognized as an international leader in the childhood bereavement field for supporting children and families who are grieving. In these 30-minute discussions, Dougy Center staff explore language, trends, research, theories, and other relevant topics related to death, dying, loss, and grief. Our intention is to continue to shape the professional dialogue in the field, and we hope to spark some thought-provoking conversations along the way. Dougy Dialogues are primarily intended for an audience of professionals working to support children and families who are grieving. If you're looking for lived experience or support for your own grief, head on over to our Dougy Center podcast, Grief Out Loud, on iTunes or your favorite listening platform. Thanks so much for joining us, and welcome to Dougy Dialogues.
Hi, I'm Alysha Lacey. I'm the Director of Program Services, and I'm joined today by Dr. Donna Schuurman, Senior Director of Advocacy and Training. Hi, Donna. It's November, which means it's National Children's Grief Awareness Month. And this year, specifically November 18th, is National Children's Grief Awareness Day. So we're kind of getting together today and just talking about that and why it's important. Do you want to maybe just start us off and give us kind of a little bit of background of what that means?
I was thinking that back in the early 2000s, when a number of us founding National Alliance for Children's Grief board members and other agencies, organizations, were talking about how do we bring awareness to the issues that children and their, families face when they have a death. And we tossed a lot of ideas around, but it really was in 2008 that Highmark Caring Place in Pittsburgh and other parts of Pennsylvania together, and I love this part, this part is really cool, is it was really driven by students that had someone die, or that had friends who had someone die and felt like, hey, people aren't recognizing, and schools aren't, and families aren't necessarily, other people recognizing how much this affects us when we have a death. And together, Highmark and these students decided to have the first Children's Grief Awareness Day, and that was in 2008. I'm not sure, and I never really got the background on why the specific date was chosen. I'm sure there's some kind of reason, but it's historically since then been the third Thursday of November. So it's always the Thursday before Thanksgiving. Again, I'm not sure why, but maybe we could find that out some way.
Yeah, I love that it was driven by the youth, and they were recognizing that some acknowledgement would be helpful and supportive to grieving people or grieving youth.
And, like a lot of things, I think it's taken a while to really expand, but now I understand that it has become an international day, not just in the United States, but also Ireland and other parts of the world. Programs and groups are also trying to recognize it. And I'm pretty sure the very first state that was asked to make a proclamation that they, as a state, would make it Children's Grief Awareness Day was New Jersey, through the efforts of Lynn Snyder at Common Ground in New Jersey. And now numerous other organizations have asked their states to make that proclamation. So I think it'll continue to become a day as we all do more awareness around it, more marketing around it, more telling stories around it. So pretty cool to see it expand, and also to see the youth involvement piece of it, which always better, right? To have instead of us as adults saying, well, I know what all the children and teens need, to have them say, well, this is what we want. This is what we want to be called. This is what is happening for us. So
Absolutely. And then to see kind of the momentum behind that continue on, I can imagine it'd be really powerful for the kids who are behind kind of starting it and getting it rolling.
well, and obviously this is an unusual year in us. Like, I know a lot of the programs have resumed either a combination of virtual groups and in-person groups or hybrid groups. And I think we've been back for about a month or so.
Yeah, just about a month exactly.
What are you seeing related to, families not being able to be in person at Dougy Center, at least for over 18 months, some of whom have never met in person, some of whom have never been to our building? What are the issues that they're raising, different than previously, or?
It's a good question. I kind of feel like yes and no. I mean, I feel like there's definitely kind of these universal things that have not changed prior to COVID, and that they're just similar issues that we see in kids and families who are grieving. So that has not changed. However, I also see families that are coming in that have had just haven't had the level of support that they need for maybe the past year and a half, or maybe they've had another death, or their death has happened in that time and they haven't really been able to access services quite when they needed it. Also, in a time when there's so much other stress in their life with the pandemic, and limited access to maybe just natural like family supports, or not able to do things like kind of memorialize their person in the way that they had wanted because they can't gather. So I feel like there are a lot of impacts from this past year and a half that kind of add on to the things that we've already kind of been used to seeing with grieving families.
Yeah, a lot of complicating factors that they have to kind of wade through that weren't there 2 years ago. So,
Right.
One of the things that strikes me as you were saying that, Alysha, and kind of is always present in my conceptualizing of how people grieve and how children grieve, how teens grieve, is this idea that's kind of in our mainstream, maybe mental health world or thanatology world, that we sometimes look at grief through an individual lens, like, oh, you're struggling and it's your problem, or maybe you find someone who diagnoses you with a mental disorder because of how you're grieving, or how someone else is perceiving that you're grieving. And it seems to me, even before the pandemic, but perhaps even intensified by the pandemic, that a lot of what kids and parents and adult caregivers talk about in groups is how people are there for them or are not there for them. So, the social context in which they're grieving, and not just these ideas that grief is only depression or anxiety or this or that, that it's so much bigger than just the individual. And that idea, like you said, like we couldn't gather in the way that we would have, and that feels like disregarding to the person who died, as well as it takes some of our it puts a different cast on how we were able to support each other
Yeah.
and honor the person.
Yeah. It makes me think, I was in a group the other day with a middle schooler, and it kind of somehow it came up. They were talking about ways that people had like surprised them in their grief, like things that they were not expecting. And it actually was kind of a theme in the group is that the most surprising things were when people actually would reach out and acknowledge in a way that felt good. Like that was surprising to them that someone could actually get it right, which is, a little bit painful actually, when you think about like the default response. It's kind of not always the most helpful. So the most surprising and supportive thing to these kiddos was when, a teacher or a neighbor or a friend would just kind of be there for them in a way that felt really good and supportive.
Yeah, that is unfortunate that would be surprising, as opposed to, well, that's what we do and that's how we do it. And so it is good to hear, though, I'll say, because I've also heard the stories of, we felt more alone. Because I some of the stories of parents over the years of like, I see people visibly try to avoid me in the grocery store, recognizing like, well, they don't know what to say and they feel awkward. And so they're suddenly interested in the cereal aisle in a way that I feel they're avoiding me. Now people don't have to avoid you, so they have to make an extra effort to reach out.
Right. Yeah. I mean, I just all the more reason I think that if we're able to spread about the impact of what grieving children, the impact of their lives, if we're all able to kind of get tuned into that more, how much more powerful and supportive could we be as like the community of people on earth able to support each other.
And I wonder, I know I'm just kind of taking this off the top of my head here, but one of the things I'm wondering about is like, what are the big things that we would want people to know in a Children's Grief Awareness Day? Like, or not just that day, but like, what are the messages in addition to the things we're already talking about? Like, grief is not just individual, it's social. Trying to think of some of the things that, kids have told us over the years that are important to them. Is any?
I mean, I think maybe an obvious, but just grief is natural and normal, that kids grieve too, that they're very aware of what is happening. And it's not just like, oh, that doesn't impact them. They're a kid, they're not even realizing what's happening.
They'll get over it. They're resilient.
Yeah. Yeah. Maybe also just things like, it's okay for a kid to not look like they're grieving, or maybe their grief is not quite like visibly evident. They're not going to be always sad or crying or talking about their person, but they're able to be happy and laughing and joking with friends and still grieving.
Mm-hmm.
I don't know, what other things can you think of?
Well, it's interesting because today I was reading a report that was in today's paper, actually, on a study of and it was girls and teenage girls, and it was following them kind of through the pandemic and looking at some of the ways that it impacted them negatively and ways that maybe it impacted them not so negatively. And one of the things that came out was they were sort of forced to spend more time with their families, and they were in some ways forced to spend more time with themselves and like to look at hobbies or things to do. And one of the results of that, according to the study, was we think that they, at least with teenage girls in the United States, they experience less stress around performance and less anxiety about all the things that they had to do in their lives in school and sports and all of those things. So there was kind of a flip side to that. And I think when we look at grief, like life keeps going on. And I think that's one of the things around kids and awareness and what we want people to understand. They may look like they're fine, but that doesn't mean they are fine.
Yeah.
And it's not like in some cultures and indigenous societies, there are clearer things that you do. You wear certain clothes, you actually take time off of your usual activities. And I think for a lot of youth in our industrialized societies, it's just like, yeah, you just keep moving on and you keep going. And ultimately, I think that catches up.
Yeah.
If there aren't some ways to really be able to like process what you're feeling and do something with it, which I think is one of the benefits of places like Dougy Center and all the other, is they get to be with other kids and they get to actually find avenues for expression.
Yeah, absolutely. I think, one of the biggest things I'm hearing from families that are coming back is just like, oh, it's been so long. We're so glad we're back. Like I've waited to be in this space again. All of these things that they're just so relieved to be back in an environment where they're with others who have experienced similar things, who they kind of they feel like they get it. And they can really just kind of bring their true selves and not have to be, looking fine, or all of the things that they're kind of, I don't know, wrestling with maybe when they're not in a place where people understand what they're going through.
Mm-hmm. I think too, like in terms of things that I've heard quite a bit, particularly from teens, is they don't want people asking them all the time, like, how are you doing? Are you okay? How are you feeling? At the same time, they don't want people ignoring them. So it's always tricky with teens. And I remember in one of our videos, one of the teens says, you have to know when leave me alone means leave me alone, and when leave me alone means please stay here and don't go away. And she kind of laughs and giggles and then says, I know it's hard, but we're kind of in and out. And I think that's one of those things a lot of children and teens, although not all, of course, seem to be kind of bounce in and out and in and out. And I just think it's so important for parents and other adults to just check in with them. And I mean, one of the things that I think is helpful is just to say, like, I don't want you to feel like I'm cross-examining you, and I don't want you to feel like you're under a spotlight. At the same time, I want you to know I care. So, would it be okay if I just kind of occasionally say, can I check in with you about how you're doing, about dad's death, or, and not that piece of like, I'm an adult and I have all the answers.
Right. Yeah, just the power of listening, kind of offering an opportunity to talk if they're in a space where they want to engage in that, and then just really sitting there and listening and absorbing that is so helpful.
Yeah. I mean, this may be a little personal, Alysha, and if you don't want to address it, please feel free. But I know you've had some recent deaths in your life, and you have, children of your own. So you're doing this professionally, and you're also experiencing your own grief and their grief. Has anything surprised you about how your kids are reacting, or?
Yeah, absolutely. I mean, it is interesting. I think as a professional who, does this is my life's work at this point. And I know so many things. I don't know what's the word, like, I know all the education, I know what to tell parents to do. And then
Like
when it's my turn,
book language, right?
yeah, exactly. When it's my turn to do it, it's like, like, I'm not sure. They don't really look like anything's impacting them, or, they're not really talking about him as much, those kinds of things. So I think I have to just put myself back in the shoes of like, kind of listening to my own advice, I don't know, trusting that those things are really true when it all comes out. And I see it with kids that I work with every single day. And then for some, wild reason, it comes under your own roof and you're like, wait a minute, I don't know if I know anything here.
Yeah. Yeah. Well, I mean, no, I don't know anybody that would recommend like you do family therapy with your own family, right?
No.
It's like we don't get to avoid things, death and grieving people we cared about because we're in the field,
Right.
So I will say, I think it being in this work and listening to so many stories and seeing some of the trends, and, one of the biggest trends that I see, and not trend, well, trends in language and things, is just the power of listening and being present. And especially with teens, of not like advice giving unless you're asked for advice.
Yeah.
And just opening up the conversation, like, what's that like for you? And are there ways that I can be helpful? Or,
Yeah. Absolutely. I think we're a little bit nearing the end, but Donna, I'm really curious just about like what are your hopes for Children's Grief Awareness Day and month moving forward? What would you love to see?
I would love to see it be a truly recognized, I don't know if I want to say holiday, but certainly day that has national and international recognition. I think we've been moving that way solidly. And I do think that with the information that we have about how many children worldwide have experienced the death of a parent, adult caregiver, or maybe both parents or all three parents, in cases of families with stepchildren and everything. I think we have the opportunity as professionals in this work to continue to make it something that is recognized, and it's only going to help our youth. And again, I go back to how we started our conversation, that according to Highmark, it was the students themselves working with them to say, we ought to make this a national grief awareness day. And I think we just kind of continue to move their work forward.
Mhm. Yeah, I love that. I would love if it were, something that was so recognized by everybody that really the work around it was just, kind of getting that collective involvement that there didn't need to be, I guess, so much education because people just knew it was just kind of a natural response that we're acknowledging children's grief and all that comes with it.
That's the work we all get to do.
Yeah.
So
Well, it was great talking with you today, Donna. Thanks so
yeah,
much.
great to talk with you too. And we have I know a lot of organizations have activities planned and materials, and it's great to see more of those as well. So,
Absolutely.
all right. Take care.
You
Thanks,
too.
Alysha.
Bye.
Bye-bye.